Lung cancer is the second most common cancer in men and women. How well do you know the signs to look for, or even would you be the one at risk? To talk about that and the importance of early detection for lung cancer, with us today is Dr. Mohammed, thoracic medical oncologist with Cone Health Cancer Center and an expert in the lung cancer field. So I'm sure, people think they're at home tonight and they're thinking to themselves, well, I've never smoked before, so I'm sure I'm not going to be someone who needs to get tested for lung cancer. But let's talk about who is at risk for lung cancer.
Thank you, Tanya, for having me again to talk about lung cancer during the Lung Cancer Awareness Month. Any one of us is at risk for lung cancer, and we always say that if you have lung, you always have a risk for lung cancer. So no one is immune from having lung cancer. Of course, the risk is higher on patients with history of smoking, former smoker, and family history.
Okay, so are we seeing more men or more women with lung cancer? And then what kind of ages are we talking about when it comes to a lung cancer diagnosis?
Definitely. We're still seeing more men with lung cancer at the moment because of the history of smoking in the mid 20th century. But the number of men who smoke is now coming down. So we really start seeing almost equal number between men and women. And when it comes to younger age, we start seeing more women with lung cancer than men.
Okay, and so what are the signs that we need to be looking out for or paying attention to in our own bodies?
Lung cancer can come with specific symptoms to the lung or general symptoms. So the specific symptoms to the lung are usually cough, coughing blood, chest pain, shortness of breath. These are more lung symptoms. But it also can come with significant weight loss that unexplained, or general fatigue and malaise that no explanation for it.
Yeah, and I think people just kind of pass off general fatigue thinking, it's just the world that we live in these days. So if you are feeling those kinds of symptoms, when should you be going to the doctor and who should you be seeing first?
Persistent symptoms of any kind should really seek medical attention. Usually you start with the primary care provider, and then they will take it from here with referral to a specialist if needed.
All right, just like anything else, there are plenty of screenings and options for lung cancer. So what should we be talking to our provider about when it comes to those screenings?
If you have a history of smoking or you current smoker, you need to talk to your primary care provider about screening for lung cancer. Fortunately, at Cone Health, we have a screening program for lung cancer. There are certain criteria that you look for when you to be screened for lung cancer: age between 50 to 80, history of smoking within the last 15 years, and also 20 back year history of smoking. If you fit these criteria, you can be a candidate for screening for lung cancer. Unfortunately, we don't have a screening based on family history yet, but that's also something that you need to talk to your family doctor about if you have a strong family history of lung cancer.
All right, and what does the screening entail?
It's a low-dose screening, so it's annual low-dose screening. And as I just mentioned, the criteria for the screening, and it's a CT scan of the lung, but with a less cut and low dose. So the expected amount of radiation is much less than the standard CT scan.
Okay, and then let's talk about the importance of early detection.
This is a very good point. We love to see lung cancer in early stage because the survival is so high if we detect it in early stage. Just to remind you that stage 1 and 2 lung cancer have 5-year survival between 60 to 80%. But if we catch lung cancer at late stage, when it's stage 4, the 5-year survival is only 10%. We like to see patients early so we can cure them with surgery or radiation or sometimes additional chemo and immune therapy. We hate when we see lung cancer coming at late stage, which unfortunately 50 to 60% of the patients we're seeing so far come to us at late stage lung cancer.
Is that because they just aren't feeling the symptoms?
Yes, lung cancer at early stage doesn't cause a lot of symptoms unless you do the screening. Unfortunately, when the symptoms start happening, it's usually too late.
I understand. Okay, we're going to continue to talk about this, especially since it is the second most common type of cancer for men and women here in the United States. We all need to be hearing a little bit more about this. We continue after the break.